So hi, everyone. We're almost ready to start. There's a few more people in the waiting room that are about to join us. So we're almost ready to go. Welcome, as always, to, I guess, our first installment of the 2022 year. COVID is still ongoing. We haven't left that back in 2021, unfortunately. I hope everybody is staying safe and taking care. Well, I think we'll get started as there's still some people coming in. So hi, my name is Damon Dagnone, welcoming you on behalf of our humanity and healthcare team of myself and Shayna and Catherine and Erna and Hugh. It's always a great pleasure to share an hour together. And tonight we have the pleasure of Deji joining us, who I'm going to do his introduction in just a minute. Deji and Jennifer, that was a great video that you sent out on Twitter. I don't know how many people were able to see that, but that was really, really great. And also, Deji, this quote that you shared with us about everybody deserving kindness and compassion. We're really looking forward to talking with you over this next hour and your reflections on and lessons. Let me just move forward. Before we go any further, as always, we acknowledge that we come together and we're situated on the traditional territories of the Haudenosaunee and Anishinaabe peoples. It is a real privilege for us to be together, to learn and share our stories today and acknowledge the privilege we have of the lands where we live and learn together. Our planning committee, the five of us that I mentioned, we don't have any specific conflicts of interest or disclosures for this session. And I think after 2 years Zoom, I still forget to unmute myself at times. I think everybody, unless you have your hand up, will just remind everybody that we do encourage you to put your hand up, whether it's your hand here using the reactions button to put your hand up or putting a question in the chat. We monitor it closely and we really encourage everybody to join in the conversation. And so without further ado, I would like to introduce Deji Ayonrinde to our session. Deji, it's really great to have you with us. Deji is an associate professor in the Department of Psychiatry here at Queen's. He is the clinical director of community mental health at Providence Care. He's also the chair of the Commission on Black Medical Students here at Queen's. And Deji is so many things. I've had the privilege of chatting with Deji a couple of times in preparation for this talk tonight, and I'm, as if it wasn't obvious already, I'm quite excited to get going. So with that, I'm gonna exit out of a screen share, and at the end we will chat about next month. So Deji, I was joking before that we probably could take an hour introducing you and all the things that, all the wonderful things you've done in your life. I was wondering if maybe we could spend the first couple of minutes with you telling us a little bit about yourself, the work that you do in Kingston, and that we would start there.
Great. Well, thanks, Damon, and thanks to everyone who's joined in this evening, afternoon, morning, depending on where you might be in the world. It's actually a great privilege, and I'm presenting after a number of you have, and I recall just how struck I was seeing people bear out their hearts about the reality of life. Now, for what I do, I'm a psychiatrist, I'm a consultant psychiatrist, and I work in the community. That means my primary day-to-day psychiatric practice is not hospital-based, but in the community, visiting people in their homes, seeing people in vulnerable spaces, and supporting them primarily to stay as well as they can be without going into hospital. I work with an assertive community treatment team, and this involves working with people with severe, enduring mental illness who otherwise may be in hospital or go through significant suffering. It's an honor and very humbling working with people, these communities. I mean, these are pretty much our brothers, sisters, mums, dads, colleagues with mental health disorders in the community.
Great, thanks, Deji. You know, Deji, when we've chatted over the last couple of weeks, a lot of the stories that you shared with me really stemmed from, and the thinking about this talk stemmed from you spending some time at the hub over Thanksgiving, as not in your, we'll say not in your professional career role per se, but as a volunteer. And to me, the most powerful stories you shared with me were just that, your interactions as a volunteer and not as the community psychiatrist. I'm wondering if we could sort of start from there and talk about some of those interactions and what it feels like to be a volunteer versus as a psychiatrist when you the interactions are different, as you've said.
Well, thanks. That's a great question, and I'll give a bit of background to it. Many of us have volunteered in one way or another in our lives, so I'd say what I have done isn't unique. Many have volunteered their way into med school, nursing school, PT, and other careers. And part of it was reflection, deep reflection on what the true meaning of Thanksgiving is or was. Well, it's a yearly event, but there's a lot more to Thanksgiving than turkeys. You know, turkey is eaten, feeling full and belching. I mean, there's a lot more to it. And what my career has taught me is for every significant life event of joy, there are also people going through a difficult time then. So Christmas, people miss loved ones. Thanksgiving, there'll be people who are lonely and isolated. And I had the opportunity to volunteer in the hub, integrated care hub, thanks to the management team of the hub for the opportunity as well. And it was quite an experience like no other, because what I was able to do was do all the shifts overnight. And I'll give an insight into some of those. So some of the commoner activities many people get into when they're volunteering amongst homeless populations is, you know, serving tea, you know, serving soup and so on. And I'll say I've broken my all-time world tea record in my life. I've never made so much tea in my life. I probably also never heard so many thank yous within a time span in my life. But those were the sort of earlier bits. Other experiences were around things that we just never think of. You know, bathroom checks. And it's a completely different skill set. I salute all my bosses during each of my volunteer times. And my bosses were actually students from Queens. I had a boss who's someone with lived experience, who brought a lot. So for each of the departments, so bathroom duties was the person goes to the bathroom, you're setting the timer 5 minutes with the person's name, and then you knock on the door. And why 5 minutes? Because if you go knocking and there's no response, the person may have overdosed or may be dead. And learning to build that in. And when you've got about 4 alarms going off, check-in. So that was an experience. Another experience was doing the security rounds, 2-kilometer perimeter with a flashlight, searching for people who might potentially be dead in driveways, under a tree, by a bench, and so on. And when you're doing that at 1 a.m., 3 a.m. in the morning, you got a completely different take on life and also what you might come across. But there were experiences also that were just mind-blowing. And what I'm going to be referring to now are some observations or experiences that were mindfully, I observed, and not because people were trying to do it for glory. And one that struck me, and it's stuck with me will probably stick with me for many years to come, it was an autumn evening, getting quite chilly, and there was a young woman asleep on a slab of rock. And this other person who was part of the same community, walking by, an older man, seen this young lady on this slab of rock, not observed by anyone. He took off the coat he was wearing, placed it over her to make her a bit warmer, and walked on. That was a masterclass in actually being kind and compassionate without doing it for glory, because he probably wouldn't have noticed that anyone noticed him. And that was really symbolic. Another experience that comes to mind is someone in one of the sleeping quarters, they call them pods, who has stage 4 cancer, and he was in agony, so much pain. However, he didn't want to wake everyone else up. So he left the pod, came out of the building, and went closer to the woods to sort of yell out in agony and the distress of the pain he was going through. Now, that was a sense of community whereby he wanted to preserve the sleep of the peers, yet I guess from the neighbor's point of view, they'll be hearing a man yelling in the middle of the night in the woods, not knowing it was stage 4 cancer. So those are some examples. I could touch on a few more, but there was kindness, kindness, kindness galore. When you observe, for instance, someone who's post-stroke, who can barely walk because the effects of having a stroke, and other people who are sharing the experience of homelessness, trying to do rehabilitation, encouraging him to take a few more steps. You can do it, just take a few more steps. Let's help you exercise your limbs and so on. Not because they were qualified, but because they were kind and wanted this person who was very different to them to do well. So I'll just touch on a few examples, and I'm sure there'll be more to come.
Thanks, Deji. I'm wondering if maybe I've got some notes here from before, and we spent a bit of time before chatting about, what it means to be mindful, and about everybody having a story, and you and I have sort of chatted about all the things that are going around us in the world that maybe we don't see because we're so busy doing our own thing in our own lives and careers, and sort of the care that we give. I was hoping that you could sort of talk a little bit more about I don't know if it's a philosophy of mindfulness, but how you sort of, in the context of these stories, how you approach that term.
Yes, well, without sort of boring from an academic point of view, but in this context, I'll be referring to mindfulness as just being present in the moment and using all your senses to absorb what the moment is communicating with you. And I would say we all come across amazing acts of kindness, compassion, caring. Sometimes we don't register them. And occasionally it's just observing the impact of the most simple looking event. It could be a smile. I'll give an example from Christmas. During the period I spent on Christmas Day, I observed there was a Christmas card written by a young member of the community. She was about 6 or 7, with a $1 coin sellotaped in the card. This was handed over to an older man, and I watched him stream tears. Now, I wasn't going to ask him. I mean, it would have been inappropriate. He was in a special emotional moment of his own. But this 6-year-old somewhere in the community had written a card with amazing, kind words. In such a way, an older person read that card and was streaming tears. This happens around us all the time. All the time. Hospital canteens. Does someone remember to say thank you, or smile, or hello, and so on? So I'd say they're polysensory experiences. A few days ago, we had the snowstorm, and there were people in sub 30 degrees in their tents, trying to stay alive and cope. It was absolutely heartbreaking being there. Yet these people also would pop out their heads and say hi, and others were also rushing down, taking them tea, soup, and so on to make sure they were alive, and others just checking in to make sure they were coping. So that's a sort of overview of just the sensory experience and mindfulness of being exposed to these events daily, and whether or not we're actually learning from, they're around us, but whether we're soaking it up and reflecting on them or not.
Thanks, Deji. I'm just going to pause here if anybody wants to ask a question. I've got lots of stories to ask Deji, but if there are any questions that somebody wants to put up their hand or contribute. Deji, as most of us here are, almost all of us on this Zoom session are healthcare providers, certainly lots of trainees as well. I think I see the faces of a few, healthcare administrators as well, who probably have a healthcare background prior to their admin roles. And I wonder if you want to comment on the contrast between the psychiatrist who shows up at the integrated care hub to care for patients and carry out your professional role versus the volunteer who doesn't have a role other than volunteering and magically somehow, as you've described before, you kind of blend into the background and are able to get people tea and wondering if you could chat with us about that contrast.
Yeah, I'd say working with mental health and people who live with either common mental disorders, anxiety, depression, or severe mental illness, schizophrenia, bipolar disorder, head injuries, and so on, is working and living in a space full of stigma. And we owe it to the people we serve to be champions and advocates against the stigma they face. Now, it's probably no secret that also those of us who work in mental health live with stigma as well. And I challenge many of you to reflect whether or not you've cracked a joke regarding psychiatrists. Oh, psychiatrist, ooh. Oh, well, what did you expect as a psychiatrist? The color of the socks, oh, as a psychiatrist, and so on. And the stigma that goes with psychiatry and sometimes the difficult roles we are involved with or in can affect how we interact with people in the community as well. Occasionally, we have the difficult role of involving police and supporting people who may be in an unsafe situation to going into hospital and so on. So when I link it to the hub, when I go to that sort of setting, as some people refer to me as Dr. A, formally with my lanyard and all the strap-ins that come with the title of being a psychiatrist, people are suspicious of me. There's a degree of hostility, suspicion, mistrust, and one must pause and reflect, what's it about us and how we communicate or what we symbolize that generates that? When I go in as a volunteer, it's a very different story. I mean, people I could never chat with professionally. As a volunteer, there's a lot of sharing, and maybe further on, there's an experience I'd want to share. I might as well share it now. There's a woman who's extremely vulnerable with a severe mental illness. My heart breaks for her when I see her in the community. I've attempted to assess her in a professional capacity many times over. And this person would just walk away or scream, yell, finds what I represent as a professional very distressing and goes away or doesn't want to engage. Thanksgiving, under a starlit sky with my boss for the security rounds, we stood out around 2 a.m. in the morning, and this person was sharing their life experience. And it was particularly touching because this person had stories of trauma to share. She just wasn't going to share them with the psychiatrist. but she was sharing them, and these were heartbreaking stories. And we couldn't have been more different. This was a white woman, Canadian, who was not a health professional, and well, I am what you see. And we had very little in common. And as this woman shared her distress, she then ended it by saying she was counting down to the number of days till the anniversary of the death of her mother. That autumn starlit sky took on a completely different meaning, because this woman's mother and my mother died on the same day. We shared an anniversary. We were counting down the same number of days in our anniversary grief. And there and then, under this cool autumn starlit sky, there was a connection like no other. Somehow, I can't explain it. Whether my empathy has changed, I don't know. I don't think so, but I feel more connected, and somehow I'm able to have a different sort of dialogue with this person than I ever could. Maybe our mums have had a chat somewhere in heaven or the galaxy. So that's an example of how being the psychiatrist, or in quote, the shrink, the person involved in sort of work we do, can be quite different.
Thanks for that, Deji. That story, I think hearing it the second time, I thought I got all the first time, but the second time they're even more sort of impactful and really reinforces, I think sometimes the dichotomy of, you know, our professional role and person role, and yet we're it's just, you know, we're the same person that shows up to these different interactions. There's two really great comments in the chat and or questions. I'm going to start with Tanya's first, and then Colin will move forward to yours after. So I'm going to read Tanya M's comment in the chat. Deji, these stories are so memorable and relevant. Thank you. How do you keep your own compassion tank full to continue this difficult work? And what are your red flags that you might need a break?
That's a great question. And I'd say, what fills my tank? I'm very fortunate to be, or consider myself quite blessed to have amazing friends, confidants, and people around the world, and connected in some situations, perhaps hyper-connected, both within Kingston or not. It's really interesting that also some of the most amazing acts of battery charging kindness I've experienced, I mean, strangers or people who, there's an anonymous person I won't mention who just, one day we met, it was a chance meeting, and she adopted me as her baby brother. And, you know, she's big sis, we share, we confide, and that's just, it's big sis. My first brutal winter, which all winters are brutal when you come from the UK, big sis kitted me from head to toe. Here's the shopping list. No, you can't go like that. Your neck's exposed, and so on. Or an elderly neighbor who knitted me a toque and just said, you know, I've noticed that you could do with something warm for this winter. So I'd say part of it's probably my personality, and perhaps I'm a person who has a cup more half full than half empty. I certainly grew up around a lot of compassion and values of compassion and kindness. Mum's slogan was, whatever the situation, seek an opportunity for gratitude, because it's there in that situation to be grateful. And it's something pretty much embedded. So I'll say friends, the love of family, personally, but possibly my own personality, and some days are rough, but yeah, none is that brutally killing.
And Deji, the second part to that, can you think of a time where you're like, oh, I need to take a day or two off, or more than a day or two off? And just the second part of that question there.
Yeah, that's bird-in season. And there's nothing like going into the bush, into the woods with a camera, telephoto lens, and birding. I mean, that is, I thank every single bird that has feathers or not, every single fledgling, every single osprey, heron, and every other bird or wet feathered friend for the companionship, distraction, the therapy offered. And I'll say in my moments of seeking peace and solitude, I'm in the woods with a camera birding. 4 to 6 hours, good dose, no side effects.
Great, thanks, Deji. I'm going to move on to Colin's question, which is, how do you see us engaging a doctrine of unconditional humanistic love and connectedness so that we balance the voices in ongoing discourse in our society, so all are heard and cared for, and so we do not fall prey to the zealotry of the present social justice movement with its erosive identity politics, standpoint theory, and various non-evidence-based activist critical theories?
Oh my God, that question is off to the bush time. But on a serious note, I think if we look at our learning and our training as medical professionals or health professionals, in the caring profession, I think that it's not easy to teach empathy. And sometimes we have to draw on it from our own lived experience. And I agree, there is potential for a degree of arrogance and hubris in being in a care profession. Here you are, the caregiver, care provider, and you've got a person vulnerable, needing help, seeking help, and there's a power gradient. And we should check ourselves. If you're feeling really good because you walked into a room and everyone's saying, "Good morning, doctor," is that appealing more to your narcissistic side, or are you really there to care? I've got one of my closest childhood friends from Australia who quit medicine for nursing because the person wanted to care, really care by the bedside, care day in, day out, and not in the way it was done in medicine. And the person till today lived a fulfilling life in nursing. People think, goodness, how can you quit medicine to become a nurse? But I'll spare the name just in case the person's here, but the person felt way more fulfilled and had a rich career for it. So I know it's probably a waffly answer to such a sophisticated question, but what I am trying to say is there's a lot more we can do to reflect on compassion and our experiences. And sometimes when it doesn't come naturally to us, I would invite us to look at experiences we've had, maybe a loss. If you don't have natural compassion for pain in another person, imagine yourself with a toothache that's lasting 1 day, 2 days, 3 days. Imagine yourself with a toothache lasting a week, a month, 6 months. Then you'll have a bit more understanding for why people may feel suicidal when they've had chronic pain. So it's being able to draw onto these different experiences. Again, a bit of a waffly answer. That was a sophisticated question. I'll need to read it and respond in writing, Colin.
All right. Catherine, did you want to go ahead and?
Sure, thanks, Damon. Deji, I picked up so many different things that you've spoken about have struck such a great resonance, but you spoke about you're deeply embedded in the community. Your work is deeply community oriented. And I just, a comment on, a deeply embedded or community lens juxtaposed with a more institutional lens. I can see how challenging it is if you work in the confines of an institution. You know, you may not have the same lens on people's experiences as you do. Any reflections on sort of the different settings that we work in?
Yeah, I think one of the great things about being a community psychiatrist is an opportunity to go, for instance, do home visits across the spectrum, to interact with people across the spectrum of society in a way that's not institutional. So, for instance, with the pandemic, a lot of people went into video conferencing, you know, all sorts of sophisticated video and teleconference capability. However, within my work population, only 14% have video conferencing capability. And there's a huge digital divide. There's huge digital inequity going on in the community. 86% of the population I work with and serve do not have that capability. So that comes with advantages because it means all through the pandemic, I've done home visits or seen people in the community, sometimes for being creative, and you learn so much. I'll give an example from the period of what I refer to as the summer of blackness, during the turmoil with Black Lives Matter and so on. And there was a particular client, an artist, who was very keen that I saw him at home. I visited him at home and I teared up. This person has spent days doing an oil painting of a Black family with love and tender strokes to the artwork. Now, you'd never see this in an outpatient clinic or in a sort of institutional capacity. Or a young, well, not so young, a man who sits outside my clinic, outside the service, 3 seasons a year. Every day he has very few social networks and sits out there. And occasionally I get him to take me on a walk. So we have our lunchtime walk. This person lives with severe mental illness. And I've probably learned more about the school structure in Kingston and educational structure, how to layer your clothes for winter and so on, speaking with this person with a long-standing history of schizophrenia. We joke about it because when he's told friends that he goes on a lunchtime walk frequently with a psychiatrist, they think it's part of his illness. But I've become quite fond of him, and his dream in life is to visit Montreal one day. He's never left Kingston. He taught me a lot about gratitude, and he probably triggered some I think about gratitude as well. And when I once asked him, you know, what does gratitude mean to you? It's a kindness, you know, that sometimes he feels just so grateful because people have smiled at him that day, or people have said hello, and so on. So these aren't things that come within the framework of institutional power. They're human on the streets and in the homes.
Thank you for that. It's such a privilege that you have been able to have those opportunities.
Thank you.
And Debbie, I saw that you had your hand up, and I'm sorry I missed that.
Technology as I try to unmute myself. I'm so delighted to join this discussion this evening. I was blown away, intimidated by your video. I didn't understand most of what you said. So I'm thrilled that I can understand what you're saying now. I'm a retired pediatric social worker, didn't have a lot of experience at Hotel View with adult mental health. But I'm now volunteering full-time at one of the meal programs in town. And I echo everything you've said about the hub, that I visited a number of times, giving them some of our leftover food, etc. Many of our clients work their way all the way from the hub downtown to get their lunch from us. I've developed some, what I can genuinely call friendships with many of the clients. I was delighted this morning to persuade a few of them to go around to the front door of St. George's Cathedral to get their first COVID dose. Many of them got their second or booster. But I wanted you to comment on a phenomenon again, because my background was not in specializing in mental health, a phenomenon that I've observed a number of times. Individuals who are clearly living in a psychotic moment as they approach the window to get their lunch. I now go outdoors onto the sidewalk and hand out boxer shorts and socks and winter coats, etc. But I'm blown away consistently when these individuals who clearly moments before you could hear the conversation they were having with someone in their head, you know, a block away, screaming and cursing and doing whatever, they seem to rally and have a moment of lucidity, certainly of gratitude. But I think, what's going on there? I don't get it.
Yeah. Well, I'll say thanks so much, Debbie. And I share that observation. Sorry if I did interrupt you. There are a number of people I used to see, and the concept of social distancing wasn't COVID. It was around the world of stigma and avoiding people that don't look like you, or they frighten you, or you feel uncomfortable with. And if I was going to be really honest, there were some of these people I was socially distancing from on the streets. They were loud, walk in a really aggressive way, and I think, okay, I'm going to risk assess this and just play safe. And the same people, I'd be within arm's length, serving them tea or soup or sitting at a table with them. And it was really different. And I think there's something about compassionate space, even when people are living with immense distress and mental turmoil, that seems containing and safe. And you've thrown something that we should probably look into a bit more. I'll get to your details, but there's something about it. You trigger also another cue, having mentioned pediatric and young. Another short story. And this was, again, the night of Thanksgiving, around 1:32 in the morning. A young man comes riding in on his bicycle, in the UK called push bike, comes riding on his bicycle, skids in, and everyone around knew him. And he had come from the youth shelter. What was he doing at that time of the morning? He just came to check in to make sure his mum was okay. And he was reassured his mum was okay. He was given some biscuits and you know, some food and so on, put in a bag for him. And he got back on his bicycle and rode off back into the night to the youth homeless shelter. Now, how many of us as grown-ups at that respond that way towards our own mothers? And all he wanted was to check mum was okay. Mum's okay, reassured she was safe, fine, and off again into the night. So there's so much we can learn from young people, and disclosure here, I couldn't do child and adolescent psychiatry as a full-time career. It used to churn me emotionally. And an example was a young person who wrote a note and drew me a picture and said I shouldn't read it till everyone had left the room. And I read it, and it was, you know, dear doctor, please can you be my daddy? And I was just streaming tears. And professionally, I can't do that every day. I mean, I love young people and supporting, but the emotional toll, so that'll be one of my red flag areas. To do that day in, day out as a career is difficult. And the reflection in that space is, my, oh my, young people need love. They don't care if it's too fancy or wrapped in ribbons, just feeling loved and secure. And that's one thing we owe. And they can give it, as I exampled in the story earlier. But thank you, Debbie.
I'm going to go to the comments. There's two there right now. I'm going to start with the second one and then lead into the first one. Danielle Kane, who I have the pleasure of being friends and colleagues with, writes a lovely comment here about empathy coming more easily to those who are comfortable with their own vulnerabilities, because being Empathic often forces us to go to that dark and vulnerable place in ourselves in order to feel with someone, to walk with them, to meet them where they're at. And that's hard and requires lots of self-knowledge and willingness to enter into uncharted emotional territory, but so important for patients. Thanks, Danielle. I think your comment sums the feeling up very well. And I'm going to take Danielle's comment to go to, I'm sorry, I don't know your first name because it has your last name there. I see your video there, B. Goodwin, whose comment is, we all know that, or comment in question, the hidden curriculum is powerful. Have Deji, you or I noticed any changes over the years in the modeling of compassion within the healthcare learning environment? And I don't know if Deji, you want to go first, and then I think Catherine, I have a little tidbit to comment on, and Catherine has one too. But Deji, you go first.
Well, thank you for that. And I would say, Mans and the hidden curriculum, our experience with hidden curriculum is going to be influenced by who we are as well. And I would say, so as a Black male in Kingston, my hidden curriculum or observations may be really different to someone else. There'll be some areas that are shared, but there will also be others that will be rather unique. And I'll never forget a quote I heard, whether it was a quote, but it stuck, that a particular Jane Philpott said to a graduating year of medical students, or I think they were doing their white coat ceremony. The moment you put that white coat on, it's not about you, it's about service. And we really need to continue to train and reflect on what does it mean to serve? What does it mean to be vulnerable? Is there a hidden curriculum of masculinity in healthcare? Do you have to be macho and strong all the time? Are you less a man if you feel or if you're hurt? Are we supervising and training people to be, super tough and rugged and out of touch with their feelings? And I would say, speaking for myself, part of my hidden curriculum, well, it's not hidden, my visible curriculum is being different. So being Black in Kingston, I know what it's like to be different. I live in the margins in some way, but I'm not in the margins in other ways. And there are all sorts of marginal intersections, if I can speak that way. But I know what it's like for someone perhaps living through poverty, which will be different to my experience, but to feel different, to occasionally feel left out and so on, and being able to draw on that. There's some aspects I won't be able to draw on, but I really think the hidden curriculum and being able to mine it, seek it out, be mindful of it, and apply to learning is one of those gifts. It's like one of those buy one, gets 4, 5 free. And it may well be that through hidden curriculum of learning experiences, the things you're learning, for instance, COVID had its own hidden curriculum. People have learned virology. They've learned geography. People realize, oh, these countries are in these places. They've learned Latin and Greek. People can now say alpha, beta, delta, all the way to Omicron. Many would have known that before. So there are many hidden curricula, and hopefully the hidden curriculum of kindness and compassion without compassion fatigue is something we'll need to continue working on, and modeling.
Thanks, Deji. Stephen, you put in a comment that is exactly what I was thinking about now and have thought it before. Did you want to come off mute and expand on what you have there about professionalism?
Sure.
And tension with caring for people and patients?
Yeah, I guess my sense is that there is still this expectation that in order to be professional, you can't show that human side, so that you feel, or I certainly feel, when sitting with a patient and sharing some of the terrible experiences they're going through and the emotions they're having. If I were to start crying with them, that would be considered a boundary breach, something wrong. They're not supposed to do that. All those kinds of things run in the back of my head, and so it forces a kind of a distancing at a time when the closeness is what's required. And so I feel we've got a ways to go in terms of how we define being a professional in this day and era.
Yeah. Well, I mean, I'd totally agree with that. And Stephen's an esteemed colleague, very kind in many ways as well. And thank you for all you've done and continue to do. It can be tough. And I'd say in psychiatry, sometimes we're immersed like tea bags into really difficult emotional stuff. You listen to someone describing your own life. I'll give a personal example. 2019, I lost my youngest brother in Melbourne, Australia. Gutted. I won't talk about it too much because I'll display too much emotion. But then you're in clinic and you've got a client telling you how awful they feel about just losing a brother and how they don't think professionals understand what it's like. Now, the human side is just, hey, bro, let's just hug you and me both and have a good brotherly cry. But you can't. I mean, it's not professional. And that boundary of where does professionalism blur into humanity and the other way around? And this is something we'll need to continue to work on. I think medicine as a science, with humanity as one of its strong pillars, is something we need to evolve more and more. And we certainly cannot weaponize people with knowledge, sophisticated knowledge without empathy. You know, healthcare can be weaponized and we can cause pain.
Thanks, Deji. Patricia, did you want to make a comment?
Can you hear me?
Yeah, please go ahead.
Yeah.
Yes, we can.
First of all, my slogan, I was a nurse way back, both general and psychiatric nurse, but I spent many years as president of the Schizophrenia Society in Kingston. And one of the things that is disturbing me about all this is I feel all these emotions that Oyedeji feels. I feel, but there is a job for a professional to do. And please could you comment on when you can actually try and do an intervention? Because clearly some people that are walking around are so psychotic. We live just on the edge of the campus. And they could be so much better than they are if they had an intervention. Certainly during my time as being president of Schizophrenia Society, we managed to make a rather painful sometimes interception, and the person thanked me afterwards or thanked the group afterwards for doing just that. It seems to me there's not very much opportunity to do that, particularly in COVID times, but some of the things I've seen around campus with people shouting at their voices, literally. Actually, one of the funniest times was when just after the campus, you know, they had this big explosion with students throwing bottles at police. One of the psychotic people shouted at the crowd of students, "If you don't get your head down, you won't pass your exams." Out of the middle of his complete psychotic ranting, he certainly knew which end was up. It was really quite amazing. But in the meantime, of course, we're all flying off the pavement because even I will not do anything that puts myself in harm. And I think you've expressed that quite well.
Yeah.
Oyedeji, could you possibly comment on when you can actually do an intervention? Because some people that are young should not be living in this degree of poverty just because they have a mental illness.
Yes, thank you. You make a really touching and great point. And I would map that against a number of things. One, for the benefit of those who may not be mental health professionals. So psychosis refers to a situational state where the person's not in keeping with reality, so out of touch with reality. And it could be caused by many things. Being under the influence of cannabis, the use of crystal meth, having a severe enduring mental illness like schizophrenia and so on. Are there enough mental health resources for every single person experiencing psychosis in the community? No. But are services working hard to try and minimize this? And I would argue yes. So Kingston has a fantastic early intervention service for young people with emerging psychotic illness. And the ACT, Assertive Community Treatment Teams, and there are several of them in Kingston, do their best. I've discarded my work wardrobe from the UK because a lot of my work involves assessing people just like you've described in car parks, under trees, in shelters. And I must say a lot's been done in partnership with the police, with Kingston Council and other agencies to get interventions early and quickly for these people. Would the score sheets be 100%? No, that'll be complacent and arrogant and if not ignorant of reality. And I would say community mental health is a community initiative, by the community, with the community, and various services, organizations do offer an opportunity to collectively support. The cost of housing is tough for some people, and how can keeping and maintaining a roof over your head. There's, as I said, the substance misuse issues, opioid issues with drugs and so on. So for community mental health, it's the community's mental health. It's the community working collectively together to support mental health, whether it's young people in school or nursery, all the way. So I would say from cradle or womb, all the way through to tomb. But point taken, lots more to do. And this is a call for action. All hands on deck. Thank you.
I'm on mute, off mute. Thanks, Patricia. Thanks, Deji. We have a few minutes left. I wanted, there's B. Goodwin. Sorry, I don't know your first name. Do you have a comment that you wanted to bring forward? And then I was hoping we follow that with Eva's comment and question.
Thank you. It's Bev Goodwin. I'm another fellow psychiatrist, and sorry, I didn't notice how that was coming up. And I just wanted to follow up again. First of all, I wanted to say I'm so grateful that this conversation is happening. And my question around hidden curriculum and modeling, I mean, I think modeling is so powerful. And there are certain moments that I remember with great difficulty from my training. And when I came back and trained in psychiatry, a little over 20 years ago, I remember a moment in the emergency room when one of our not well psychiatric patients was being seen by me in the seclusion room, and I was greeted by the ER physician outside with a group of trainees around who basically said to me, "Would you get this piece of excrement out of my emergency room?" with anger and, kind of a contempt in the voice. And I certainly feel that stigma that spills over from our patients toward ourselves. And that was one of those moments where I was completely speechless. I didn't know how to respond and try to connect with the humanity of the person and the humanity of the doctor. And I just wondered, as I say, those kinds of moments stand out for me from a few decades ago. And I was curious what people are experiencing now and hoping for some change in the modeling that's happening.
Well, thank you so much. And I'll say lots more to do. I'm conscious of the time, but I'll give a speed answer. A lot more to do. And we owe it to keep on breaking the barriers of the stigma and so on in these situations. As a psychiatrist of color, I can take this up a few notches because there are times you're offering or expected to professionally offer empathy, caring, compassion, just after the person's called you the N-word. You've just been called a monkey, then you're expected to provide compassionate care. And it's digging in really, really deep. So there's a lot more to do, just like my response to the other question. We're nowhere near there, yes, there's a lot more to do. And I think just giving ourselves permission to be vulnerable, speak about these things, accept that we're human and we can be human. And whatever it is, even if it's 60 seconds ago, I would love to salute 3 people who've touched my life immensely. Permission to salute them, Damon, or?
Oh, yeah, sorry, Deji, I thought that was you pausing and collecting yourself to salute them.
Okay.
We don't have to end it at 6 bells. We always tend to go over just a couple of minutes to all of us finish our thoughts. Please go ahead.
Okay, well, just for the acknowledgements, well, not just. Today is the 8th anniversary of the death of my close friend, classmate, and one-time apartment mate, Dr. David Hart. He was a cardiologist in the US. David had cancer, knew he was dying, was compassionate, probably one of the most humane physicians I've ever known. And he worked his waiting list till he couldn't work or see clients any longer. I learned a lot about dying and legacy in care from David. I'd want to honor Matthew Seligman. Matthew was one of my dearest friends. Went to Cambridge University, studied history, for many years played bass guitar for David Bowie. And Matthew had the courage, or should I say Matthew's son, had the courage of living with a name like Deji, D-E-J-I. Matthew then retrained to become a mental health barrister and advocate, and he did that valiantly. Our dream was that there'll be a secret gig for mental health in Kingston, but it never came to be. Matthew died of COVID. But what did Matthew do just before dying in London, England? He had a number of clients with mental health issues that needed representation, and just before intubation, requested to be able to ensure that each of these key clients had someone available to look after them in case he didn't come around. He never came around from intubation. Matthew, I salute you. In Kingston here, my neighbor and very dear friend, some of you may know her, Dr. Pallavi Nadkarni. Dr. Nadkarni, the kindest psychiatrist, always had a moment of kindness and compassion, just could read a mood and brought life into every situation. We sadly lost Dr. Pallavi just over a year ago to cancer. And I've got a curry she cooked. It's still in my freezer. I can't eat it, but no way do I have the courage to dispose of it. And long may it remain in that freezer. But not only did Dr. Nadkarni do that, while she knew she was dying, she kept her clinical records to prepare a clinical bio for medical education and support learning of others, so they would learn about her experience dying. So I just thought I had to mention those 3 amongst many others, but those are 3 that come to mind or that I feel able to talk about without crying. And of course, thanking Mum for the tissue and the hanky. It's still coming in useful from the grave, and perhaps my transitional object like Linus in Charlie Brown.
Thanks, Deji. Eva, do you want to comment quickly, and then Erna has a comment or question, and then we're going to try and wrap up.
Oh, I think that's a good way to end. I wouldn't step over Deji's acknowledgements. I just wanted to, I mean, maybe in the same way that you just saluted those people, Deji, I want to salute the people who work at the Hub whose jobs are actually a lot, in many ways, harder than ours, and who don't get nearly the recognition, either financially or in terms of their representation in our community that they deserve.
Yeah, and Eva, thanks for that. I'm going to geek out quickly. I'll try and keep it with 60 seconds. Drawing on business school background, there's a concept known as VUCA, V-U-C-A. And a VUCA situation is something that's V, volatile, U, uncertain, C, complex, and A, ambiguous. V-U-C-A, VUCA. It happens in Emerge, but my, oh my, it happens in places like the Hub. we've got situations that have, you don't have the triage rules, the structure that you have within Emerge, and we salute every single person, young, not so young, and old, who supports this population. What you do saves lives. You may not see it, you may be paying forward and saving lives without seeing it, but we salute every single person.
Thanks, Eva. Thanks, Deji. All right, Erna.
All righty. It's hard
Jump
to
in
wait.
here.
Well, it's hard to wait when you really want to talk. So Deji, I have so much I want to say. 30 seconds, 60 seconds would be super tough. We're going to continue a conversation with a lovely cup of tea that I'm going to make you at another time. But I just want to make some parting comments. First, I would like to officially welcome you as one of the first Kingston physicians into the School of Nursing. Your words and your compassion tonight resonate with who and what we are. When I decided to be a labor and delivery nurse, everybody said to me, why would you be a labor and delivery nurse when you can be an obstetrician? And I said, well, I want to be a labor and delivery nurse because I want to be with the women in labor for the whole labor. So there is a beautiful nursing theorist who writes about the theory of caring, and the elements within it, the first one is being with. And all of the concepts that you have discussed with us this evening so beautifully are about being with the other. So no matter what type of healthcare provider we are, if we are with the other authentically, with tears, nothing wrong with a few tears. If we're with them, then they see who we are. They see our compassion, they see our empathy, they see our presence. And we, I'll do a Jane Philpott. We, as Queen's Health Sciences, can do that when we come together. So Deji, thank you so much for all of the ways that you've shared with us tonight. I would welcome you to come sit on the snow bench in front of the School of Nursing. It's very important. I do have a little treat I'm going to share with you at some time, and I think we have a great future of some wonderful things to talk about. Thank you so much.
Well, thanks so much, Erna. And I'd say a quick naughty one from Christmas, not really naughty, but the School of Nursing sent loads of Christmas cards to the hub. And there were lots of people there comparing their cards.
Oh.
And people saying, I can't believe it. You mean people in the effing School of Nursing care about us? Wow, I didn't know they cared. But they were so touched. They really were touched. So thank you.
You're welcome.
I'd also want to honor, as probably my closing comments, my Yoruba Nigerian heritage with a number of proverbs. One from my grandma, which is Adien Lagun, Iyeni Ojari. And it means even chickens perspire. It's just that the feathers may cover up the sweat well. Another being Onisuru Lomfunwara Kiniun, meaning it takes utmost patience, tolerance, resilience, and trust to milk a lioness. If you go rushing in, there'll be consequence, and relationships aren't a given gift, we earn them. And finally, and I think of this in a community spirit, I see migi, I see mieye. If a tree sways in a storm violently and turbulently, birds will be unable to perch. So as a community, if we do have people who are poor, destitute, suffered severe mental illness, going through distress, it'll be difficult for the community to know perfect peace. Thank you.
Deji, yeah, I see clapping hands. Deji was beautiful and lovely, and I'm sad that our time has come to an end for this anyway. It's really great to see so many faces. Terry, love your thumbs up there that I see. And lots of smiles and so many comments in the chat. Catherine had put some modules in there about compassion, which is great, and just so many lovely comments. And I hope that most of us can continue these conversations one-on-one, whether it's tea with Erna or in the hallway or corridors or wherever it is that we are. And I'm going to put up who's going to join us next month on February 9th, Dr. Karen Smith, talking about the privilege of caring for others and learning from others. So I really feel like it's flowing from how you've started the year off here, Deji, talking about her career journey, as Karen says. So thanks everybody for coming. Thanks for a few extra minutes. And Deji, a true honor and privilege to have you with us. What wonderful hour of my life that we all just shared together. Okay, I think with that, I'm going to say goodnight to everybody, and everybody take care and stay safe.